I'm Nicole Nalepa, and you're listening to Mommyhood Unscripted, real talk about moms for moms. Hey everyone, and welcome to a short but sweet episode of Mommyhood Unscripted. This is a quick listener review, and we're getting right to the point about the topic of perimenopause and menopause. Two words that you may hear a lot about on social media now being thrown around, but you may still not know a lot about. So that's why I ended up taking your questions to one of the top experts in the country. So as I was screening through the hundreds of comments and emails that you wrote in, I noticed that there was a theme emerging. So many of you had the same questions. So enjoy this short but informative episode on perimenopause and menopause. So the big question, probably one of the most common questions that kept coming up from women, was when is a woman officially menopausal? And how do you know that it officially has ended?
So, menopause is defined as being 12 months without a menstrual period. So, the average age at menopause in the United States, about 51 years. The vast majority of women will go through menopause between ages 45 to 55, though some women, about 1%, will have premature menopause before age 40 and another 5% or so between the 40 and 45. So the vast majority between age 45 and 55 for menopause. You know, when especially you're in those general age groups and you haven't had a period for 12 months, that's very, very likely to mean menopause. You could have blood tests checked, but usually docs will not check for hormone levels, unless you're at a younger age, much younger than expected for menopause. Now, perimenopause is a different story. So perimenopause is a transitional phase of life where your periods start to become irregular and you start to have more fluctuation in the hormone levels, but you have not yet gone through menopause. So you may be getting at first periods more frequently, like every 3 weeks rather than every 4 weeks. And then the periods start to space out to be every few months. And eventually you're 12 months without a menstrual period. And that's when menopause occurs. Perimenopause is often 5 to 10 years. Where women are having these irregular cycles and fluctuations in estrogen, progesterone levels.
And that's so hard for a woman to really plan out. When we get our periods, it's very, it almost seems always
Right.
inconvenient. I've heard talk of some OBs recommending, why don't you just go back on the birth control pill or, do a birth control method just for the mere sake of skipping your periods. You don't have to deal with it if it's a nuisance to you. Is that safe?
Yes, low dose birth control pills can be very safe during the perimenopause. And in fact, there can be some value to that because women need to understand that during perimenopause, where they are having irregular menstrual cycles and these fluctuating hormone levels, they may still be intermittently ovulating, which means they can still become pregnant. So during perimenopause, it actually is recommended to use contraception if you do not want to have a pregnancy, because it can occur. And many women are very surprised by pregnancies in their 40s because they thought once the periods became irregular or they started to have some hot flashes, they couldn't possibly become pregnant. But they are intermittently ovulating. Now, once you go through menopause, you're not ovulating anymore. Once you're officially gone through menopause and there's a more dramatic decline in estrogen levels. So that's a big distinction.
Okay. Thank you for answering that. Number two, the second biggest question I got, hot flashes, will they ever go away? How can we minimize them? Is it true that they continue after menopause?
Yes, they definitely continue after menopause. And in fact, the average duration of hot flashes, night sweats, the hallmark symptoms of menopause is 7 to 8 years. And some women will have these symptoms for a decade or longer. So definitely do not expect that these symptoms are going to go away in a few months. They can be quite prolonged, and there's a wide variety of severity of these symptoms. Some women are not bothered by them, they're very mild. And they don't need any treatment, any pharmacologic or prescription medication treatment. Other women are quite bothered by these symptoms. And if the symptoms are bothersome or moderate to severe, interfere with daily activities, impair quality of life, or disrupt sleep, then it is really important to talk with your healthcare provider, talk with your doc, your clinician about these symptoms because there are many treatments available, both hormonal and non-hormonal.
Okay, I'm glad you said the non-hormonal component because I also had some people write in saying I would be for the hormonal therapy, except I can't take it because of my risk of blood clots. So you're saying that there are some other non-hormonal therapies that would be a safer alternative, say, for someone who does experience blood clots or is at risk.
The good news is that there are many more options available to women now for managing menopausal symptoms, hot flashes, night sweats, even some of the genitourinary symptoms such as vaginal dryness, discomfort with sexual activities. So there are many treatment options available with menopausal hormone therapy. If a woman is a candidate, there are lower doses. There's now transdermal patch estrogen, which is believed to be safer than the oral pill form of estrogen that was tested in the Women's Health Initiative. But even with the type of hormone therapy, estrogen plus progestin tested in the Women's Health Initiative, the women who were younger ages, if they were below 60 or within 10 years of onset of menopause, the benefits tended to outweigh the risks if they were having moderate to severe hot flashes or night sweats. It's really the risks are particularly pronounced once women are at older ages or they're more distant, well over 10, 15 years past onset of menopause. That's when you don't want to be starting hormone therapy for the first time. But it usually doesn't come up to start for the first time because the symptoms of menopause, the hot flashes, night sweats, tend to be most severe earlier in menopause. So that's when a woman would more commonly be treated. Now, if she's not a candidate for hormone therapy, we have several categories of non-hormonal treatments, including antidepressants, gabapentin-like medications, and also a new class of medications that are FDA approved that work in the brain to work on temperature regulation that takes place in
Hmm.
the brain. And an FDA approved product is fezolinetant. Now, all of these non hormonal treatments are effective and relatively safe. No medication is entirely free of any risk, even acetaminophen. Okay. So, but when you talk about benefit risk ratio and a woman getting relief from bothersome symptoms, hot flashes, night sweats, disrupted sleep, those quality of life benefits should outweigh any small risk associated with any of these prescription medications.
Okay, wow, that is great information. And I'm sure the women that wrote in are going to be very happy to hear those alternatives too. Thank you for that.
Let me say that not all women require prescription medications for
Okay.
menopausal symptoms. Many women will have symptoms so mild that they can get by with just, having regular physical activity, maybe making a few diet changes because they notice their hot flashes come on when they drink hot coffee. So they go to iced coffee. They make a
Mm.
change like that. They lower the thermostat. They, sleep, they wear layered clothing. They avoid spicy foods or triggers so there are certain changes that can be made if symptoms are quite mild. However, women who have really bothersome symptoms, disrupted sleep, they should discuss those symptoms with healthcare provider and explore options for prescription medications.
You brought up diet, and what I'm getting out of this is if you're starting to have these red flags that we're talking about more, it's important to check your diet, to check your exercise. But there was the top three question I received was all about how do we restart our metabolism? Because, so many women who are writing in to me said, I've done everything. I've been exercising. I've been watching what I eat. I've been upping my protein intake, yet my body is still holding on to this. So how do I restart my metabolism?
So, probably one of the most important things to do is to begin strength training
Hmm.
and resistance training to really increase muscle mass and help with the bone density as well as the amount of muscle. This will help to boost the metabolic rate and will go a long way in improving physical function, quality of life. So it's really not enough just to be doing aerobic exercise. Add the strength training, 15 minutes, 30 minutes, 3 times a week, 2 to 3 times a week at a minimum. That amount of strength training will go a long way. Also, it is true that some change in body composition occurs with menopause. You may not notice it on the scale. It may not be a clear weight gain, but it may be just an increase in waist circumference and that there's more abdominal fat mass because there's shifts in the body composition. And again, the best way to deal with that is regular physical activity, strength training, as well as some changes in the diet. It may require, a little reduction in calories, but also, really going with unsaturated fats, that plant-based, more of a plant-based diet, whole grains, and, getting adequate protein. But you want to avoid refined carbs, the processed foods, really minimize or completely eliminate, ultra processed foods. That's hard to do, I know.
Hmm.
And some ultra processed foods like yogurt are still pretty reasonable. But try to minimize the processed foods and also, things like processed meats. I would say refined carbs. It's better to go with whole grains, more plant-based diet, and whole foods. Like fish is great. Poultry is fine, but predominantly, a plant-based diet.
I've done a lot of reading and I've this was actually a question that came up from a few saying that they've seen that there's some correlation between once you hit perimenopause or menopause symptoms, it almost there's been an uptick in the rate of, people being diagnosed with neurodivergent disorders
Oh,
and
okay.
things.
Okay. Some increase in symptoms, especially like related to difficulty concentrating, attention deficit disorder, symptoms like that can be related to disrupted sleep, which can occur more commonly with the hot flashes, night sweats, interfering with sleep. And so it is really important in order to minimize that to get adequate sleep and to seek treatment for symptoms that are disrupting sleep.
Okay. And I wanted to play a quick little game of fact or fiction. Fact or fiction, menopause is just hot flashes.
Fiction.
Menopause, oh,
Menopause is far beyond hot flashes. There are many, many other symptoms and many other physical changes that occur in the body beyond the hot flashes.
menopause kills your sex drive.
It can actually have some effects. on both libido and having discomfort with sexual activities, but those are symptoms, especially vaginal dryness, discomfort with sexual activities, that can be treated. There are effective medications that are available and they're quite safe.
Okay. And one more. Menopause never starts before age 50.
That is definitely fiction. In fact, the average age is 51 in the United States. So there are many women, nearly half of women, who are having menopause start before the age of 51. Most women will experience menopause between the ages of 45 and 55.
Okay. Well, thank you so, so much, Dr. Mason, for coming on Mommyhood Unscripted. I appreciate your time and all of this information that we could pass along to the women here.
Okay, great to talk with you, Nicole.
If you like what you heard, make sure to subscribe to Mommyhood Unscripted. Share it with your friends, too. It's available on iTunes, Google Play, Roku, and everywhere else you get your podcast. I'm Nicole Nalepa. Thank you so much for listening. And remember, Mama, you're doing great.